So I will open the meeting, and I have an opening statement that we are required to read during this era of Zoom meetings. So, in accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting this evening, September 30th, 2020, on the Zoom platform and in accordance with the town's policy, directive, and guidelines issued on April 1st, 2020, as amended. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town's website. All committee votes will be taken roll call, and we will start with an attendance roll call. For members of the public, please unmute yourself when I'm open the meeting to public comment only. And so, do we have Jill Block?
Present.
Ray Considine?
Present.
Mark Haddad?
Present.
Alma Healy?
And
All right, board members are all here, and Susan Rask also here. So I believe we will move on to the first agenda item of the evening, and this is a public hearing for a definitive subdivision on 48Y Fitchburg Turnpike. I think we were given a map of the area that is mostly in an adjoining town, and then part of it in Concord. Susan, I believe you were going to give us a little bit of a summary of this project as well.
Sure, and we have the applicants here with us, so I'm going to really hand it over to them pretty quickly. I
Okay.
did send you my staff comments, which I actually don't have in front of me. No, I don't. Well, it's basically, it's a 45-acre parcel, something like 45-acre parcel in total. Most of it's in Sudbury. There's a 15-acre parcel in Concord that they're asking. It's a definitive subdivision for a 15-acre lot, which will be accessed off a new road, which is tying into some private roads in Sudbury, which come off of 117. And with that, I think we'll turn it over to Matt Leidner of Civil Design Group, who has a presentation for you.
Good evening, board members. Hopefully everybody can hear me.
Yes.
Matt Leidner with Civil Design Group. I'm here on behalf of Quarry North Road, LLC, the applicant for the project. And with me tonight from Quarry North Road is Chris Clausen and Chris's counsel, Bill Henchy. They're both on, but I'll do the overview of the project, and we're happy, any of the team members here are happy to answer any questions that you may have as we go through this. So as mentioned, the site is 48Y Fitchburg Turnpike. Would it be possible, can I bring up a plan, or is it possible for?
Yeah, you've just got to hit the share content button and then your screen will share.
Which map? Which map? The full map? Oh.
Can everybody see this?
Yep.
Yep.
Okay, excellent. Okay, good. So the site is what's shaded in gray here, and the town line. So as mentioned, part of the site is in Sudbury. It's actually the majority of it is in Sudbury, and then part of it is in the town of Concord. This diagonal line across the page is the town line. So Sudbury is to the south. North is up on this plan. Sudbury is to the south, and then Concord's up here to the north. So the site lies in both towns, as mentioned, and currently the tract of land has frontage down here on Route 117 North Road in Sudbury. And so as part of the, what is the Coldbrook Crossing project in Sudbury here, we will be creating a network of roadways in Sudbury. But the byproduct of that project is that if we were not to propose this subdivision that's before you tonight, we would end up landlocking, cutting off this piece of land in Concord and not providing with any frontage on any roads. So that is sort of what has led to the point we're at now, which is filing a definitive plan to create a right-of-way in Concord here. So it's this black hatching right here in order to create frontage and therefore preserve frontage for this tract of land in Concord that if we were not to do this would end up being landlocked. So that is the purpose for which we are here tonight, is a simple subdivision to create a single lot with frontage on this proposed right-of-way along the town line. And so if I go to this sheet here, just a brief overview of the site itself. It's the former Malone Quarry. And so again, this is the same orientation as the previous plan. Here's the town line running through the page here. And this is a plan of existing conditions. You can see the topography. And so where the contours are really tight, so all up through here, that's the extent of the former sand and gravel operation that had been conducted by the town of Sudbury on this site. And so we're proposing everything to do with this subdivision, the roadway and the associated grading is all within this limit of gravel pit that has been disturbed as part of the historic gravel and sand operation on this site. So we're up here with the proposed road. So if I go to the proposed plan here, this is zoomed in slightly, but here's the proposed right-of-way right here. Here's the town line just below it to the south. And so the proposed right-of-way is approximately 900 feet long, actually just shy of 900 feet. And what's shown sort of in a lighter gray here over the town line in Sudbury is the approved road network in Sudbury that this Concord road will interconnect with and loop through. So the road, the piece in Concord that we're proposing for the subdivision is a standard Concord subdivision road, 22 feet wide, 5-foot sidewalk running along one side. And we've provided all the, in our plan set here, we provided all the required plans in terms of grading, drainage, landscaping, layout that is required by a subdivision plan. And so in terms of drainage, we're collecting all the stormwater from the proposed roadway and treating it and then infiltrating it. We are in a zone 2, so we are treating to the zone 2 standards, which are more stringent. 100% of the runoff from the proposed roadway will be infiltrated up to and including the 100-year storm. And so that system is down in the bottom right southeast corner of the project. Because no buildings are proposed, we are not proposing any septic systems or any water services or wells because no buildings are proposed. But the sites, I can tell you, and as you would imagine, being a former sand and gravel pit, the soils through this area are sands and gravels, and we've done extensive test pitting, soil evaluation throughout much of the tract, and the soils are what you would expect for a former sand and gravel pit, so conducive to that type of development. But on this plan here before you, there's no buildings proposed. So with that being said, I'm happy, or any of our team members here are happy to answer any questions you may have, or if there's a specific topic that I didn't touch upon, I'm happy to go into it. Thank you for your time.
So there's no buildings being proposed on this, for this development? I think you lost me there. I'm confused.
Right, that's correct. You're correct. There's no buildings being proposed. The only reason we're proposing this subdivision is to create frontage for this piece of land in Concord, that if we did not create frontage for it, it would end up being landlocked by the development that has been approved in Sudbury. So we need to create a roadway in order to create frontage, in order to keep the lot as a lot with frontage in Concord.
So that someone could go and develop on it at a later date, in other words.
Potentially, right. So it keeps the site, right. It keeps the site having frontage and area, so potentially being developed in the future. But that is not part of this proposed plan. And there are limitations on what could, if anything, could be developed there in the future through the applicant's agreement with the town of Sudbury. So there's a limitation on what could be developed there in the future.
Could you speak a little bit to the whole subdivision and sort of the land swap you did in Sudbury and why there are restrictions on this 15-acre parcel?
Matt, you want me to jump in on that part?
Yes, please. Thank you.
Sure.
Bob.
Madam Chairman, this is Bill Henchy. I'm an attorney from Orleans down here in Cape Cod. I represent the applicant. So there is a lengthy history here. Let me work backwards and then I'll answer the health director's question. To the chair's earlier question, and this is completely natural. So what are you planning to do with the property, right? This land is owned by the town of Sudbury, and under the disposition agreement that we have with the town of Sudbury, any development in Concord is limited to no more than 6 residential units on the entire 15 acres. So the maximum that can be developed here is 6 residential dwellings. To answer the larger question of how the land swap came to be, it's a long story, but I'll try to give you the elevator version of it. My clients had proposed a rather dense development adjacent to town center that there was litigation over with the town of Sudbury in both the land court and the Housing Appeals Committee. And as part of the resolution of that matter, my clients participated in an open public bidding process with the town of Sudbury for the disposition of the Malone property. They were awarded the bid by the town of Sudbury to propose a development on the Sudbury side of this property. A plan was created, which was ultimately approved by the Sudbury town meeting in a very large and very public vote. And so we've spent the last roughly 18 months going through the permitting process on that side of the development. It's been through MIPA. The town of Concord, in fact, submitted comments to MIPA, indicated that the town did not object to the proposed development, but expressed some concerns about the planning considerations. We have been directly in communication with the Water and Sewer Department and with Mr. Cathcart in order to carefully design the wastewater development for the Sudbury project so as to be outside of the Concord Zone 2 and to not affect the town of Concord at all. And this part of it here is sort of the last piece of the puzzle in terms of the permitting for the overall site. As Matt pointed out, really the only reason for this is that if my client didn't propose this definitive plan, those 15 acres up in Concord would end up landlocked. So in order to be sure that they don't end up landlocked, this plan is proposed. And for the reasons I've articulated before, no development is proposed at this time. And candidly, my clients haven't figured out what they're going to do with it, whether it will be devoted to some agricultural use, whether it would be devoted to a solar use or some other use. It's a matter of right. Whether there would perhaps be an application for a special permit for planned development under the Concord zoning, or whether there might be a more conventional subdivision of a couple or 5 or 6 estate-sized lots. They don't know. So this is solely an effort to preserve the existing frontage, and what will happen down the road will be the subject of some further discussion, I'm certain. And that's the short version. Sorry about that.
So if this isn't approved, then is the project still able to proceed?
Well, the Sudbury side would proceed. That's correct.
Is Emery Lane and Coldbrook Drive, are they private roads or are they public roads?
Those are private ways. Those have been approved by the Sudbury Planning Board on a definitive plan that they have already approved.
So to access the landlocked, potentially landlocked part of the property, one would have to cross private roads to achieve, to access it. Is that right?
Well, at present, the property has frontage on Route 117, which is a public way. That's correct.
But Colebrook and Emory are not, do they intersect with 117?
They do. Matt, can you show the can you show the larger plan on your screen so that the board member can see? There you go.
So, but you said those roads were private roads.
That's correct.
But they're not currently there, are they?
They've been approved by the Sudbury Planning Board. They don't exist today. That's correct.
Right, because I live off of 117. I drive by here and my children used to access the sand pit via the trails off of White Pond and the Rookery. So I'm also concerned about the conservation land that's all back there. And I assume this has had to go through NRC approval or Natural Resources approval as well, because there's extensive conservation land in there.
So there are extensive wetlands off to the northeast, and I believe those are all delineated on the plan. Nothing is proposed that would be within the Conservation Commission's jurisdiction. And obviously, if anything were proposed in the future, Conservation Commission would have a lot to say about it.
I believe this has not even been to the planning board yet. Is that correct?
That is correct. I think, Chris, are we on the November agenda for the planning board? Is that right?
That's correct. I believe we're on the November 10th agenda with the Concord Planning Board.
So if the board members, if you'll refer to my staff comments and the materials I sent you, Chapter 41, Section 81U says that the Board of Health has 45 days to review the plan. So we are reviewing it because it came in and I wanted to get it scheduled for this meeting within the 45-day time limit. We could have done it on the October 20th meeting and still been within the 45 days, but just in case we don't have that meeting or something comes up, I thought it would be better if we got it on this agenda. So you're actually seeing it before the planning board sees it.
So what are we approving here today? I mean, what is the question for the Board of Health to answer?
It's a definitive plan of a subdivision that they're asking for your approval. So again, if you read Chapter 41, Section 81U, such health board shall, within 45 days after the plan is so filed, report to the planning board in writing approval or disapproval of said plan, and in the event of disapproval shall make specific findings as to which, if any, areas shown on such plan cannot be used for building sites without injury to the public health, and include such specific findings and the reasons therefore in such report, and where possible shall make recommendation for the adjustments thereof. And failure to report is deemed approval, which is why I wanted to get it on tonight's agenda.
I mean, so we're approving, you know, something that hasn't gone before the planning board yet. So but yet, you know, you'll go before the planning board and say, well, we got the Board of Health's approval. So I feel like the steps being taken are a little out of order. You know, am I wrong? Are we just approving a road or are we approving future development here? I'm very confused about all of this.
Sure. Ms. Rask, I don't want to step on the staff here.
No, I just think they're creating a way that gives them, they have to create road frontage to the 15-acre parcel, and that's all you're approving tonight is the subdivision of the 15-acre parcel. You're not approving any development of it, and your approval is not any guarantee that anything will be buildable on it.
Right.
I mean, you're just speaking to whether there are reasons that it can't be used, you know, without injury to the public health. So you'll see in my staff comments that any development will be limited to 440 gallons per acre because it will be on private wells. There will be no public sewer or public water provided by Concord to this parcel because it's not anywhere near our sewer system or our water system. So any dwellings constructed would be on private wells and private septic. They'd be limited to 440 per acre, which Title V recognizes as protective of drinking water. We have no reason, the soil is sandy. We have no reason to think that wells and septic systems can't be installed.
And actually, I can add one more thing to that. The Sudbury Water District has indicated to us that since we're acquiring the property from the town, that if municipal water were required up here, the Sudbury Water District would provide the water. Otherwise, as the staff has indicated, it would be wells and septic systems.
But I believe most of the parcel is in the Zone 2 of the Concord Public Supply Well, in which case it'll still be restricted to 440 gallons per acre because you're in the Zone 2. Is that correct?
You took the words out of my mouth. That is correct.
Yep.
I mean, I sort of feel like our hand is being forced here because of the pressure to make sure that, you know, a parcel of land doesn't become landlocked in the future, which to me, I don't know. But that, I guess, is for the planning board to decide. Committee members, do you have any other comments?
No, I mean, I'll just say I don't, the order here doesn't bother me because what we're approving is limited. We're recommending to the planning board the conditions and recommendations, and then they make their decision. So Susan, I don't know if they have access to the conditions that you're recommending, or if we should read them out loud when we approve this, but obviously we would be voting to approve with the conditions that you would recommend.
So we will send those conditions to them, but if you want to read them out loud, I think that's a great idea.
Do you have them in front of you, Mark, or do you want
Yeah,
me to?
I guess I'll read it out loud. So I will move to approve the definitive subdivision plan with the following conditions, recommendations to be forwarded to the planning board. Number one, the applicant has not performed soil testing to demonstrate on-site sewage disposal systems can be designed and installed on the lot. Individual sewage disposal systems shall be designed, permitted, and constructed in accordance with Title V of the State Environmental Code 310 CMR 15, standard requirements for the siting, construction, inspection, upgrade, and expansion of on-site sewage treatment and disposal systems, and for the transport and disposal of septage. And B, Concord Board of Health Regulation, Chapter 3.0, wastewater management. C, sewage design flow will be restricted to 440 gallons per acre. Number two, the applicant has not demonstrated that potable water is available on the lot. The applicant must connect all dwellings to public water if it is made available. Any wells for domestic drinking water, irrigation purposes, or heat pump use shall be designed, permitted, and constructed in accordance with the Concord Board of Health Regulation, minimum sanitation standard for private and semi-public water supply. Number three, if a portion of the lot is located outside the groundwater conservancy district, site design shall, to the extent feasible, locate potential pollution sources such as on-site disposal systems outside the district boundaries. Number four, no underground fuel storage system shall be installed without a variance granted by the Board of Health in accordance with Section 4 of the Underground Storage Tank Bylaw adopted by the April 1993 town meeting. Number five, tree stumps and wood waste generated by land clearing operations shall not be buried on site. The EP Solid Waste Regulation 310 CMR 16.05 3D and 310 CMR 19.013 1H prohibit stump dumps on lots being developed for sale.
Okay, Mark has brought a motion forward. Do I have a second?
Second.
Okay. We have to vote in order.
You can say
Jill?
Approve.
Ray,
Approved?
Alma.
approved.
All right, the motion
I
carries.
approve.
Oh, sorry. I thought if you brought it up, you didn't have
No,
to.
we still have to vote. Anyway, I approve. And
All
you
right.
have to approve too.
All right, I approve. The motion carries. Thank you, gentlemen. We will
Thank
move on to our next item. on the
Thank
agenda.
you, Madam Chairman. I just to alleviate any discomfort you might feel, the order of this is actually prescribed by Chapter 41, the subdivision control law. So we weren't trying to pressure anybody. This is just what the statute requires, and the health director set it up on the agenda. So we're happy to have your consideration, and thank you very much.
You're welcome. Thank you.
Thank you. Thank you. Good evening.
I know.
All right, let's move on to item number 3, global pandemic of COVID. Susan, do you want to give us an update on how school is going?
How is school going? Well, the first week that school opened, we had a case in the middle school, as Mark knows, in the 8th grade. But I think I was actually pretty pleased with how it went. And Mark, you can tell me how you feel about it. I feel like Lori Hunter and Tricia and I and the school nurses and many others spent the summer writing the protocols for how we would respond if we had a case. And so we had a case and we used all the protocols that we had written over the summer, and I feel like they worked pretty well. We, the school had the assigned seating chart, so it was easy to identify who the close contacts were. We were notified of the case on Thursday night. By Friday afternoon, Tricia had all the close contacts in quarantine. They've all been tested and they're all negative. So it remained an isolated case. The close contacts, of course, have to quarantine for 14 days. Schools were closed that Friday, but were able to reopen on Monday. So I feel all in all, it went about as well as it could.
Yeah, so I'll just chime in as a parent. I sent Susan a note about this, but I'll just say it publicly to all you. I thought the way that Dr. Hunter and Susan and everyone handled it was really well done. As a parent, not just as a board member, I was very impressed with all of it. And I can tell you sort of anecdotally, there are a number of parents in Concord who were nervous to send their kids to school because they didn't know how something like this would actually be handled. And so their kids are all remote, and a lot of them are already trying to figure out how can we get them back into hybrid, because they were very impressed with how the school handled it. So I commend everyone. I think everyone felt safer. It sounds counterintuitive, but I think everyone feels safer having lived through that one experience, because we knew it would happen, and having it handled so well than we did a week before it happened. And there was no cases then. So anyway, I commend all of you.
So Susan, I did listen to the webinar when that case was announced with you and Lori Hunter and Trish, and I thought that was excellent. But the other day, just yesterday, I received an email from a neighbor of mine, knowing I'm on the Board of Health, who has a son at Fenn and a daughter at Willard. And he really didn't understand why a school like Fenn got closed down when all that happened. He thought that because of the, all of the contacts and the close contacts, and that was going to address it. But given that this child was unlikely to be at Fenn, why did it ever affect that school as well?
So are you talking about the current closure at Fenn, or did they close during this 8th grade episode?
I honestly don't know.
Fenn didn't close during the 8th grade episode.
So it was a new closing, so it was a different case?
So over the weekend, we got a 9th grader at Fenn whose father was positive, whose mother was sick. The child was symptomatic but had not been tested. So we did that as a presumed positive. Tricia worked with the nurse, Julie Geneva, at Fenn. The seating charts, the 9th grade class is only 20 kids. So by the time we identified all the close contacts, I think that was 17 or 18 students in the 9th grade, and the school made the decision just to quarantine the entire 9th grade. Mm-hmm. So they are all on quarantine for 14 days starting, well, their date of exposure was Friday of last week, so they'll be out for 2 weeks, so this week and next week. And in fact, the student tested positive today, so we feel like we made the right call on that one. But, we were a little bit like, well, should we quarantine everybody? We don't know for sure this kid is sick, but we were pretty sure he was going to come up positive, and lo and behold, he has. So the entire 9th grade is on quarantine, but the rest of the school is open.
So
and it's just that's how the close contacts work out in a small class of 20 kids.
Right. Right. But I'm wondering if it wasn't communicated as clearly at the private schools as it might have been at the public schools, because this is a family.
So,
I'm just surprised.
Well, I can tell you, my son's at Fenn. I mean, the communication was excellent. About this ninth grader. So I was very impressed with how it was handled.
and Fen wanted to do a webinar for the parents tonight, but of course I can't be on that because I'm here. I think we're going to do one late tomorrow afternoon or tomorrow
Yeah,
evening.
it's tomorrow. I think I just saw the email. Trisha is going to be on it.
Yeah.
Yeah, I mean, with the middle school outbreak, I was just so incredibly impressed. I think I got an email from Lori Hunter about 10 o'clock the night before asking for help to get the kids that family tested. And then, Trisha McGeehan, our town health nurse, was, working on the results even through the weekend. I just was so impressed with the number of hours people are putting into this and just being so on top of it. It's amazing. I mean, I think Lori Hunter is doing an amazing job.
I do too.
I don't know how many hours Trisha McGeehan's working, but that's amazing. So.
And I'd like to thank you, Deb, for everything you did to facilitate getting all of those kids tested, because that was hugely helpful too. The fact that Emerson can test and get us results so quickly is a key piece of this.
They got it turned around in just a couple hours, so it was good.
It's just, I mean, I'm just really happy. It's running so smoothly, and I really am starting to get some confidence that I think we're going to keep getting these cases, but I'm really getting somewhat confident we can keep them as isolated cases and not have spread within the schools. And if we can do that, I'm going to feel really good about it.
I was at the high school this afternoon from 12:30 to 1:30. Open Table has a distribution that's out of there. So I was there volunteering, and there was a classroom that was taking place outside on the lawn. I think it was a band class. And I saw a number of students. It was a big group, actually. That's why I assume it was band. There were a number of students unmasked within the seated cluster. When I saw the class dismissed, I saw many kids unmasked. I saw a bunch of boys arrive who looked like they were coming from a golf tournament. They all had their clubs with them. They had an adult with them. 7 of them were unmasked, including the adult talking to the kids. So my brief observation, also, I passed the crossing guard for Alcott at that point on my way there. All the little kids were masked, all the parents were. The police crossing them was not, though. So it was a really interesting sample for my hour out at the high school, seeing a decent amount of people that weren't abiding by these precautions. So I'd like to be optimistic.
I would send those observations to Lori Hunter. So Gabrielle was up there looking at the food service operation, because of course that's the time that the kids are unmasked, and she wanted to see how that was set up, and we had some concerns. So they kind of reconfigured that and put a lot of the seats outside in the sort of courtyard, or the kids can eat up top. And when I went to look at that, pretty much everybody was masked, and it looked really good to me. So, and Lori Hunter was with me, and Mike Mastrullo was with me, and we just kind of did the walking tour. So I think Lori Hunter appreciates your observations, because she appreciates your observations.
Okay, I'll pass it on, because I was disappointed, frankly, by what I was saying. It was not.
And we were a little upset the first time Gab visited the lunch room. We saw gaggles of kids, kind of, the kids are sort of eating at these chair desk things, and they hit. Kids being kids, they'd kind of pulled them together in groups, and Gabby was like, no, we can't do that and be unmasked. I guess they've hired monitors, but the monitors weren't really being too effective. So we're working on that. But I think, Lori was, and it was only day 4 of school. So the kids had only, because of the 2 cohorts, that was only some kids' second day of school. So, I mean, it's a work in progress, but I think Lori will like your observations.
Okay, I'll share. Especially the golf.
And I'll just chime in. I mean, school wasn't in session then, Jill.
This was today. This was
Yeah, yeah, but today's Wednesday, right?
yes, but this,
Wednesday is till 11:30.
uh-huh.
So whatever you're observing was some after-school things.
But they were after-school activities that were clearly the band. I recognized the people there. And this was clearly the golf team returning from a match, their coach. And it was clearly a cop who was the crossing guard. So school was not in session, but these were school activities.
Right.
So yeah, it was after hours, just as important.
I think it is just as important, because if we're going to contact trace, we have to know who was exposed to who. I mean, if we want to keep it as isolated cases, the contact tracing has to be accurate and timely, and, you know, and we have to know who was exposed. So I appreciate that feedback, and I hope Lori Hunter will too.
I'll share it.
Yeah.
So that's where we are. You know, we're still, I haven't looked at the weekly numbers tonight yet. I think we're still in the gray zone at less than 5 for the 2-week period. But I think many towns are seeing the numbers sort of creeping towards green and yellow. And so we're all just keeping our eye on that.
Yeah. Yeah, I mean, I think, you know, the other thing that, you know, we sent out was like what happened in Sudbury. There was a similar situation in Natick also, where the school system was, you know, the high school in Natick was shut down as well, because kids were at a party. So, you know, I know Lori Hunter is working on messaging with, you know, parents and stuff, but it's, you know, I think it's something that, you know, parents and kids bear a lot of responsibility for. I'm not sure what the answer is, because I think teenagers will be teenagers, but it's really unfortunate that a few kids can really impact an entire community. Anyway. All right. Anything else on COVID?
No, I think that's about all we need to say for now.
All right. We'll see and keep our fingers crossed. The next item on the agenda is the discussion about reorganization of the board. I didn't put this on the agenda, so I don't, Karen, you had kind of given a little bit of background, so.
Well, Susan had asked me to put it on the board because usually following town meeting is when boards and committees will elect a new chairperson. But historically, the board will rotate so that each member is chaired twice. But with the Board of Health, because of membership or other situations, people have extended their tenure, etc. I mean, there's no rule saying it, but that's just the way it's gone my entire time working for the town. And so then when COVID happened, all memberships were extended because we didn't have town meeting until September. So September is now last day of it. And Susan thought that maybe we should just at least start talking about it, or the board should decide whether or not they wanted to ask Dr. Green to extend her chairmanship through COVID-19. I don't know, but it's written up in my notes, and I just wanted to get you thinking about it. Susan, I don't know if we have to take a vote tonight or.
No, I don't think we have to. I mean, it's up to the board what they want to do.
Well, I'll just say I think it's a brilliant idea, and I definitely would request and appreciate if Dr. Green extended. And I frankly don't know what we would do in a COVID-19 pandemic if we didn't have her by happenstance happening to be the chair for this. So So thank you, Dr. Green.
All part of the big plan.
And I would echo Mark's comments. I think it's, I'd be very comfortable, Deb, that you continue as the chair of the board through next year.
Okay.
I have other ideas, Deb. I think you're doing a fabulous job. You know,
Right.
I appreciate that you've done it for a while, and it
Yeah.
could also be reaching your limit. So,
No, it's fine. It's dovetails easily into, what I do for work anyway, and, being a parent in the community too. So it's not a hardship at all. I'm happy to continue. I will hope that this also ends next spring. So then someone else can take over. So yeah, it's fine with me.
So we should definitely take a vote then.
Oh, great.
Then we should
So
just-
vote now before
We
it's
have the
too
month to
late.
change your
Before she
mind.
changes her mind.
Okay. All right. It seems weird for me to take a vote for me to continue to be chair, right?
So
Someone else.
someone else can make the motion to nominate.
I'll move to have Dr. Green continue as chair through the next annual meeting.
And I'll second that motion.
In favor?
All right.
Mark Haddad in favor?
Ray Considine in favor?
Alma in favor?
Jill? Yeah.
Okay.
Okay, I accept.
Yay.
Yay, that's nice.
All right.
Thank you, Deb. Thank you so much.
Yes.
You're very welcome. All right. Board calendar and minutes. So, does anyone have conflicts with the next couple of dates we have for this calendar year?
Doesn't seem to.
no travel plans.
No travel plans. Yeah, that's same.
Yeah. And even if you travel, you have a computer, you just zoom right in.
There you go.
Right.
Exactly. The last meeting I did from vacation in Acadia.
All right.
I love Acadia.
You're dedicated, Mark.
I was
All right. And then the minutes I thought looked fine. Mark probably had some comments, so
Only a few comments.
Just a few minor things, nothing
Few
substantive.
minor things.
okay. Do we have to approve the minutes then? Okay. So I will move to approve the minutes as amended.
Second.
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 I hear approved by Alma. Mark?
Yes.
You obviously approve. And Ray?
Yep. I approve.
All right, the minutes are approved.
Yep.
Okay. Board member reports. Anyone have anything to report?
Not for me.
I remember I was asked a question at that point. You know, I have the direct line to the finance committee in my household, and I heard that there was discussion at a finance committee meeting about when they can begin meeting in person again. So, you know, it wasn't a question posed to us, but it's interesting that it's coming up. People are hearing that. So just putting it out there. Jane?
I was just going to offer that comes up with some regularity, but obviously we're not anywhere close, and this illustrious group would be on the forefront of knowing that.
Right.
Yeah, I mean, being the person in contact with COVID patients, you probably don't want to be around me for a long time. So I don't know, I would probably say it would safest thing to Zoom for a while longer. I do miss our meetings, but I can't see that we would open up anytime soon.
That was my assumption as well, but I just don't, I wonder if there's a need for some kind of ongoing communication through the, you know, the town.
Yeah.
You know, just to like remind people that we're in this for the long haul.
Yep. Yeah, definitely.
And especially because this works. I mean, if this didn't work, then it'd be a different discussion, a different balancing act. But I think this works fine. So
Yeah,
there's no
it does.
risk.
Yeah,
The other thing to keep in mind is even if we had public meetings where the board itself got together, it would be too many people to actually open it up as a public meeting. It would still have to be Zoom. So that doesn't satisfy
Right.
usually
really
the
good point.
pressure.
Yeah.
Right.
Well, it's understandable that people are anxious to get back into, being together. It's definitely a big loss in life. All right. I was just wondering if we heard how Erin Murphy was doing, our tobacco control person.
I have not heard from her, and I meant to reach out to her and just got sort of distracted by this whole Fen thing. So I will reach out to her and let you know.
Okay. All right. Thanks for sending the information about the vaping devices. It's very interesting to see. I'm glad they're narrowing down what, exactly is causing the lung injury.
Yeah, I thought that was an interesting article.
Yeah.
I only sent it to you, but I'll send it to the rest of the board. It's a study out of UC Irvine Medical School that they now think it might be the nickel chromium heating element. So the more expensive vaping devices have stainless steel heating elements, and they were using those to study EVALI, and then they had to switch to one that had a nickel chrome heating element, and they very soon after that saw lung damage happening. So
Yeah.
Interesting.
Yeah.
yeah,
Avoidance being the only safe way.
Yeah. I mean, I still see patients that vape constantly all the time. So people are still doing it. I don't know. All right. Staff reports. Anything else, Susan?
I think that's about it. We've had some West Nile virus mosquitoes in many of the towns that are near us towards Boston, but here we are at October 1st and the mosquito population should be starting to taper off. And as it turned out, the Triple E season was pretty quiet. There was some stuff down in the Bridgewater area, but that was about it. So that is kind of a blessing.
Yeah, we were lucky with everyone being outside and all the outdoor dining. I think we were fortunate.
Very fortunate.
Oops, sorry about I have two questions when you guys are ready.
Sure.
One question was, given, reports all over the place of wildlife having increased during COVID, I don't know that the populations have increased or just the proximity. I'm wondering if we're seeing any Lyme tick or Lyme or other ehrlichiosis, et cetera, increases. And then I just wanted to ask Susan if we're getting any traction on the multiple complaints that I receive and you receive from the neighbors of the development on Main Street in West Concord.
So I've been out several times. The first time I observed some workers in the house without masks. I told them to get masked. I sent an email to Greg Kensington, I think his name is, who works for Sims, and told him he had to follow the COVID guidance. Ray Maddie's been out a number of times and not observed violations. I mean, if it's two workmen more than 6 feet apart outside, they don't have to be masked. I think part of it is that a abutter doesn't really understand what the requirements are. But I will go out there again tomorrow and I'll write them, now they've gotten a written warning, so I'll write them a $300 ticket if I observe violations.
I mean, I see it regularly, but that's because I'm not a direct abutter, but it's in my pathway. I don't necessarily go, I'm not observing for a purpose necessarily, but I don't think I've ever seen a mask. I don't know whether they were 6 feet apart or not. That wasn't my.
Right. So
but yeah,
I will go out there tomorrow again.
So
Mhm. The answer to your first question about increases in tick-borne illness, I don't know. I would assume DPH tracks some of that, right, Susan? Or
Yeah, I can have Trish pull the numbers off of Maven.
yeah,
It's all
I
reportable
mean, this is
disease.
just a curious piece of, people have asked me about it because, again, the wildlife seems to be so much more. I mean, we're getting deer here on Main Street,
yeah,
crossing Main Street in West Concord, which is kind of surprising.
yeah,
Well, the bad news is we had a mild winter, so that
Yeah.
means ticks don't get killed. But the good news is we had a really kind of serious drought all summer, which is bad for the ticks. So
yeah.
I don't know. I'll have Trish pull the numbers.
So my observation, owning a dog who walks into the woods all the time, is that there's been very few ticks, which makes me so, I'm dubious because it's not normal, but she always seems to attract them and we're not finding them. So, and I look religiously because I'm kind of paranoid about them, but not sure.
It's the same with the mosquitoes because the drought, they were very low in numbers this summer.
Yeah, it'll be interesting to see what the numbers are.
We usually get phone call after phone call in the summertime for, where do you get ticks, where can you get tested and things like that. And we didn't get anything. It's because everybody's focus is just shift.
Sure.
Right.
Yeah. COVID.
Yes.
COVID. And
Mm.
I think.
All right. Anything else?
I think that's all I have.
Okay.
Well, I want to thank Susan, all the work you guys all did, everybody did to get town meeting.
Yeah.
I mean, that was very impressive. I was
Was.
really excited to see as many people there as came. Even more excited not to have heard a single report of a COVID transmission based on that gathering.
Yeah.
Don't want any of the high schoolers to think that that was okay, therefore, but that, it was done really, really well. And thank you all.
Yeah.
Well,
Good.
I'm going to tell you honestly, I didn't do very much. It really was Carmen, so and other town staff. But thank you for saying thank you.
No, it was very impressive, the setup, everything.
No calls or complaints.
No,
So that's a good thing.
good thing.
All right, ladies and gentlemen, it's nice to see you all. So I will move to adjourn the meeting. Do I have a vote?
Second.
From Jill, second from Mark. Alma. All right, Ray.
Yep.
All right, it's nice to see you all, but have a good evening and we'll see you again in October.
Okay.
Thank
All
you.
right,
Okay.
good night.
Yeah.
Bye-bye.
Bye. Bye, Sue.
Bye.
Tomorrow.